Thanks. It's nice to be here. Thank you for having me. I'm excited to talk a little bit today about who NORD is, what we do, and our Rare Action Network program, and hopefully get some of you involved with it. I'm going to share my screen now. Just want to make sure you can see it. You guys see that okay? Okay. So I'm with the National Organization for Rare Disorders. We are a organization, we're an umbrella organization that represents the entire rare disease community. And I'm going to share a little bit about how we do that. NORD is an independent nonprofit. We support patients and patient organizations by accelerating research, providing education, disseminating information, and driving public policy. NORD was actually founded in the early 80s after a group of patient leaders, patients, and caregivers got together and advocated for what is still in law today, the 1983 Orphan Drug Act that President Reagan signed into law in 1983. In that left picture that you can see, that is our founder, Abby Myers, who actively worked on this legislation with the other patient organizations and representatives in the rare community to advocate for the Orphan Drug Act, which gave an incentive to pharmaceutical companies to want to explore research and developing treatments for rare diseases, because they, at the time, were not being developed. There was very limited number of FDA-approved treatments for rare disease because they did not necessarily bring in the dollars. So this specific Orphan Drug Act offers a tax incentive for pharmaceutical companies and some exclusivity rights to kind of entice them into the rare disease research. And it has significantly increased the number of FDA-approved treatments over the years. And it is still something that is always potentially in harm's way, this Orphan Drug Act. And so we continue to do advocacy efforts surrounding the Orphan Drug Act to ensure that it stays as is. Over recent years, it did change a little, but we still work diligently to ensure that the Orphan Drug Act stays as is. We represent 25 to 30 million Americans living with rare diseases. The definition of a rare disease is it affects less than 200,000 of the US population. It's a slightly different number in Europe. There's approximately over 7,000 rare diseases, and 90% of those rare diseases are without an FDA-approved treatment for that specific disease. So these are the different areas that NORD actually works in the rare disease space: public policy and advocacy, which I'm going to be talking to you about. We have direct patient services and patient service programs for patients and their families. We work on capacity building with nonprofit patient organizations. We have a research and innovation department. We have a research department that works on numerous research-funded and grant-funded research programs, which are just amazing, and it's actually growing every day. I can't even keep up with the amount of research work that we're going into. Community engagement. And then public education. We offer educational webinars for the rare disease community, everything from something like genetic testing 101, understanding what genetic testing is, things such as that. We usually host one once every month on various topics, and they're free for the public to join. So I'm specifically here today to talk a little bit about our Rare Action Network program, which is our grassroots-based advocacy network. It really is a volunteer-run program, and I emphasize that because of the work we've been able to do in the states over recent years. You know, a lot of healthcare decisions are being made at the state level, and while NORD has always contributed to federal policy work and advocacy efforts, and we've done days down in Capitol Hill in DC to advocate for things, we realized very quickly over recent years that there was a need to do the same thing within the states. And each state is unique as to the laws and healthcare access for all. So we developed the Rare Action Network program to help identify volunteer leaders that we refer to as our volunteer state ambassadors in the various states. And they kind of represent as a liaison between what's happening in the state and NORD. And actually today I see that one of our newest RAN ambassadors, our Alabama Rare Action Network ambassador, Benita Moyers, is on the call today. And Benita, if you want to put a little chat with your contact information, so those of you in Alabama that want to get more involved with the RAN program, please do reach out to Benita. And we have ambassadors across, I believe now we're in like 38 states, but we have RAN members across all 50 states and Washington, D.C. It's a great program. We have our rareaction.org website, which offers up information on the policy work we're doing in the states. Every state has their own state profile. And I know I'm talking to the folks in Alabama today, so rareal.org would be the Rare Action Network for Alabama's website. And you can take a look at the Action Center in the various states. The contact information for our state ambassador would be on that page, on the state pages. We do State Hill Days, we do Rare Disease Day activities throughout the country around Rare Disease Day in February. We do both state and federal advocacy campaigns within the states. We do advocacy training, education, and just awareness programs as well for the community members. And that's where our volunteers such as Benita come in to play. Currently, with the world we're living in, we're all in a virtual world still. So we've been doing some virtual rare discussion groups in the states that have kind of gotten together with the rare disease community members just to hear how this pandemic has impacted them personally in their state and see if there's ways that NORD can assist in some of the issues they may have been facing this past year and a half. We also put out, we publish every year a rare disease report card for every state. So you'll be able to see how Alabama holds up in certain initiatives, and I'll cover those pretty quickly. But these are kind of the policy issues that NORD focuses on at large. There's a lot of underlying topics and issues that go along with these, but just to give you an idea, access to affordable coverage is an important one. Affordable medications, access to diagnosis and a timely diagnosis take on average for a rare disease to be diagnosed between 5 and 7 years. Access to innovative medicines and therapies, advancing rare disease research and regulatory science. COVID-19 is obviously a big area we're focusing on now. Rare disease advisory councils, and I believe we'll be hearing from the Alabama RDAC later as well. Telehealth and the state of the states report card that I just mentioned. Some of the things that NORD advocates for that differentiates us from the disease-specific organizations is when we determine an issue that we're going to focus on, there are common challenges across the rare disease community that everybody faces regardless of the actual diagnosis. I mentioned the average diagnosis time, the 90% of rare diseases don't have an approved treatment, high costs of treatment and medical care. There's few medical experts, and they're located across the country, sometimes the world. There's little research known about the diseases, social isolation, and small scattered patient populations. So these are common challenges. So when we're looking at initiatives that we focus on, we want to look at issues that impact the rare disease community at large or a large portion of the rare disease community. And we work with our patient organizations to work on specific disease initiatives and giving them advice and direction. Some examples of the federal policy efforts that we've worked on is obviously the Orphan Drug Act, Newborn Screening Saves Lives Act, Medical Nutrition Equity Act, protecting patient access to affordable health insurance, and telehealth. And then some of the state issues that we focus on in the state report card specifically is Medicaid financial eligibility, medical nutrition, newborn screening, prescription drug out-of-pocket costs, protecting patients in state Medicaid programs and state regulated insurance programs, step therapy, and rare disease advisory councils. So this is all things that the state is graded on every year. We've just published this past February our 6th edition of the state report card. And I have the link on the screen. It's rarediseases.org/NORD state report card. You can find that, or you can visit rareal.org to link to the report card for the Alabama specific one. And what we do with our advocates, joining the Rare Action Network is a simple form you sign up for online, and then you become in contact with anything happening in your state by putting in your address. We're always looking for stories to share with elected officials on the impacts that rare disease has on their constituents. We encourage you to meet with your legislators and develop relationships with them. And we help guide you on how to establish those relationships. We also encourage bringing awareness to your community by joining the Rare Action Network. There's opportunities throughout the year to highlight the rare disease state that you represent, but also representing the rare disease community at large. I encourage all of you today to sign up. You can go to rareaction.org and hit the join button, and you'll get in touch with any activities happening in Alabama, or if you're from out of state, your state that you reside in. And we host events year round. So hopefully you can participate. Some are virtual, and hopefully someday soon we'll get back to in-person events, as I'm sure we're all hoping to do. So I would just encourage you all to join the Rare Action Network. I'm happy to answer any questions anybody may have. But thank you very much for taking the time to hear about our program and our organization today.